Hey.
Forgetting is normal. What's tough for you to remember is tough for everyone. But don't worry, we've got this together.
Frontal, temporal, parietal, and occipital lobes. In this 6th video, let's focus on the occipital lobe. Where is the occipital lobe located? It's at the very back of your skull. What does it do? The occipital lobe processes visual information like color, form, and motion. How does the visual pathway work? Light hits the retina, signals travel through the optic nerve, cross partially at the optic chiasm, continue through the optic tract, synapse at the lateral geniculate body, travel via optic radiation, and finally reach the visual cortex. The optic nerve, optic chiasm, optic tract, lateral geniculate body, optic radiation, visual cortex. The visual cortex is currently divided into 5 major areas. The primary visual cortex, V1, is where visual information is first processed. The primary visual cortex, V1, is also known as Brodmann Area 17. This is a question that comes up often. What happens if V5 is damaged? It can cause akinetopsia, where you can't see objects moving smoothly. What is akinetopsia? Akinetopsia, or motion blindness, is a visual processing disorder where a patient struggles to see moving objects properly, as if they are frozen in place. Do you know any other well-known occipital lobe disorders? With visual agnosia, you can see objects, but you just can't tell what they are.
Imagine looking at a common object, like a key. You can see its shape, color, and texture, but you cannot recognize what it is. You might describe it as a shiny, metal object with a jagged edge, but you don't know it's a key until you touch it or someone tells you.
With prosopagnosia, you can see faces, but you can't recognize who they belong to.
Oh, a woman is walking towards me, smiling. She seems familiar, but who is she?
And with alexia without agraphia, you can see words, but cannot read them.
Oh. I just wrote it a moment ago. But now I can't read it at all. The letters look familiar, but they don't make any sense to me.
The occipital lobe is the command center for vision. It's not just about seeing. Understanding is what truly matters. Agnosia, prosopagnosia, alexia without agraphia. What do you think are the causes of occipital lobe disorders? There's a lot to cover, so grab a cup of tea and listen in. A common exam question is, which blood vessel occlusion leads to occipital lobe damage? We also know that Lewy body dementia, characterized by visual hallucinations and memory impairment, is associated with reduced blood flow and metabolism in the occipital lobe. How about inflammatory diseases? Multiple sclerosis can cause unilateral vision loss and visual field defects. The most aggressive brain tumor, glioblastoma multiforme, grows rapidly and can present with visual field deficits, visual distortions, and hallucinations as early symptoms. The pineal gland, located near the occipital lobe, can compress visual pathways if enlarged, leading to Parano syndrome, a condition where patients have difficulty looking upward due to characteristic eye and movement abnormalities. We shouldn't forget toxins and drugs. The most well-known toxin causing visual impairment is methanol. Methanol is metabolized into formaldehyde and formic acid, which damage the optic nerve and visual cortex. The visual cortex and visual pathways in the occipital lobe are highly sensitive to hypoxia. Carbon monoxide poisoning can result in visual field defects, color vision abnormalities, and vision loss. Other substances like opioids, LSD, and cocaine are also known to cause visual disturbances. A vitamin B12 deficiency can lead to demyelination of the optic nerve and functional impairment of the visual cortex, resulting in vision loss. Can you recall infections that affect the occipital lobe? The JC virus, which causes progressive multifocal leukoencephalopathy, leads to demyelination in the occipital lobe's visual pathways. Subacute sclerosing panencephalitis, a chronic progressive encephalitis caused by persistent measles virus infection, can affect the occipital lobe and present with early symptoms of visual impairment. Herpes simplex encephalitis, caused by HSV1, primarily affects the temporal lobe, but can also extend to the occipital lobe. Seizures originating from the occipital lobe can present with flashes of light, visual field defects, and other visual disturbances. A classic mitochondrial disorder, Leber's hereditary optic neuropathy, causes painless, progressive vision loss in young males. Lastly, oculocutaneous albinism affects not only the retina but also the development of the occipital lobe, leading to impaired depth perception and visual processing deficits. Where is Wernicke's area located, left or right? For quick, powerful reviews, this is the only channel. Don't forget to subscribe.